Good hip motion is key to moving and feeling better, and especially if we lose the motion with crossing our legs. So when we test this motion, it's critical for anyone who's having trouble with their knee or their hip or their ankle or even low back and sciatica. So when we sit up in a chair, not slouch down, but sit up really, really tall, you want to notice the position of this leg and see that it goes down far, almost to horizontal here. And if it's up in the air or it's very difficult, you can make it less by putting this other leg, the foot that's on the ground, by sliding that forward. That's going to make the stretch easier. But ideally, to have that leg straight up and down, sitting straight up and tall, and you're measuring this angle and seeing how this sits. And then you're comparing that when you switch over, you're comparing it to your other side. And again, you're getting tall, you're letting that leg drop down. If one side doesn't go down as well, if it's up like this, there's a lot of people who have that as a problem and they don't realize it's a sign of trouble. So I'll ask them, what do you think when that side doesn't go down? Did you ever break that leg or do an injury? And a lot of times people just say, no, I'm getting old. Well, then I'll ask them, how old's your other leg? If one leg's like this and the other leg's down like this, where you have significant differences in motion, that's the sign of trouble. And so the way to work on that then is to get into this stretch position, upright in your back, tolerable, and just stay there for 10 to 30 seconds. If you can manage to put light pressure through it, that's fine. But it's critical that this doesn't cause anything more than a medium stretch. You want to be relaxed and your breathing is normal. Stretching past those points isn't going to help you get better. If it's still too intense, and even with that modification of sliding this other foot forward, if it's still too difficult to handle it, no problem. Just lay down and do it. You can even do it in bed. If you have a difference, though, please at least do double the repetitions on that stiff side to even things out. Your feet will thank you. Any knee problems, you'll thank you. Your low back and hips and sciatica. Take care.